I'd like to welcome everybody to the Tuesday, January 12, 2021 meeting of the Koochiching County Commissioners. So would you help me open with the pledge, please? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thanks everybody for hanging in there. I think we have an important issue to look at, and I'm glad we took the time to do it. First item is to approve the proposed agenda with additions and deletions. And there is one addition for highway. We'll put that under B2. So it'll be the last item before public comment.
Need a motion?
Yes.
You got it.
Thank you, Commissioner Skoye.
I'll second that.
Thank you, Commissioner Murray. Any questions on the agenda? If not, I'll call the question. All those in favor?
Aye.
Opposed? Motion carries. Thank you. Second item is COVID-19 update. Kathy, are you there?
Yes, I'm here.
Hi, Kathy.
Good morning, everyone. I'll start off with some totals for Minnesota and Koochiching like we usually do, and then I'd like to talk about some things with the vaccine. So in Minnesota right now, our total positive cumulative cases are 437,552 with 417 and 5 people no longer needing isolation. There's been, as far as tests administered, there's been 5,953,863. In the state of Minnesota, there's been 5,711 deaths. In Koochiching County, there's a total positive cumulative of 572 with 533 people no longer needing isolation. In our county alone, we've tested 11,049 people. Our percent positive is 4.8%, which is down, and is now, we're one of the, probably about 3 or 4 counties in the state with the lowest percent positive, and our deaths are at 10. As you all know, we've started administering the vaccine in our county. And I'd like to talk just a little bit about how that works, because we're getting a lot of questions, and I'm sure that you're getting some questions too. But the issuance of the vaccine was broken down into categories, and within those categories, then there's subcategories. And the vaccine is acquired by the Center for Disease Control and then is passed down to the states who then make the decisions about how those vaccines are administered. And in Minnesota, we do have a vaccine allocation advisory group in the Minnesota Department of Health that has made the recommendations for how those vaccines get dispersed. So as far as on a local level, we have absolutely no say in who gets the vaccines or when they get the vaccines. Currently, we are now in phase 1A, and that still has priorities, which are subcategories under that. 1A, first priority, of course, is all the hospitals, long-term care facilities, the personnel working in those facilities, emergency medical personnel, COVID testers, and COVID community vaccinators. Then you go to the second priority, and then you have, within the hospitals, you have all personnel providing direct patient services, some more long-term care, urgent care settings, dialysis centers, and things like that. Then the third priority is all of the other people that work in those places, along with dental offices and other public health clinics, mental behavioral health centers, for them to get the vaccine. We have not moved past the first priority. We had if we were to want to vaccinate anybody else in the 1A that is not in the first priority, we would have to get special permission from the Minnesota Department of Health in order to do that. And they're being very tight about how these vaccines go out, to the frustration of some of us. In a smaller county like we have, we may not have as many people in some of those priorities. And so we kind of feel like we're waiting sometimes to move on to the next. Also, the vaccines, there's 10 doses per vial of vaccine. We had received 100 doses, and we are going to receive another 100, I believe, this week. And we do have enough vaccine for the second doses for the people who have already had one dose. So I know people are frustrated. There's a lot of calls coming in about when can I get the vaccine. We're going to put out some more messaging, probably through the paper, in our Facebook page, on how this works, because people are frustrated and they have a lot of questions. We also are going to have a mass testing event, which is going to be January 20th to the 23rd at the Union Hall. It's a saliva test. The National Guard is working with us and MDH and helping us get that set up, but we do have the dates confirmed for the 20th to 23rd. I don't know what hours the center will be open. Most of them are open like noon to 6 or 10 to 6 or something like that. So as soon as we have that information, that'll be going out into the community. It will, it includes the entire county, and we do have it set up so that all of the county will get notification and know about that event. Is there any questions or anything?
Yes, I'm sorry. Go ahead.
You know, I mean, I've had a lot of phone calls, and I had one this morning here that I was working on before we started. Could we get that in the paper? Because what people are lacking is information. I know we have our committee and stuff, but, you know, I think it needs to come from your department and let people know just what you're telling us. I think a lot of people think the county controls this, who's going to get the vaccines, and it's hard. I just think we need to lay it right out for people so they understand how this is working. I know a lot of people are afraid and others are frustrated and et cetera. And so if we can get them the information through the newspaper, radio, whatever, Kathy, I think that would really help them. The sooner the better.
Yep. Laurel had reached out to me yesterday, and I started to prepare something for her. So I'll be connecting with her later today, and we'll see what we can get going.
Thank you very much. Appreciate it.
Yes, Director LaFrance. So as far as doing these vaccinations, there's some concern. I've gotten some emails saying, for like Essential Health, they got to go down to Virginia to get their shots, and there are concerns in regards to that, time away and so forth. These 100 that we have, is our public health able to give any of those vaccinations out?
We have given out the first 100 doses that we received. How the vaccines are passed down, I guess you'd say, is the hospitals like Essentia and all the major hospital groups, that they got their own vaccine. They have their own vaccine. They tell their staff how they're going to administer their vaccine. So if Essentia has decided that, you know, people have to go to a hospital setting in order to have their vaccines, they don't have a hospital here, so they may be requiring their staff to travel to get that. The staff need to be working with their administration at Essentia to come to some kind of agreement about how that happens, because we cannot give vaccines to people who are part of a healthcare system like that, where the healthcare system has already received their vaccines. some of the different entities too are also working with pharmacies. CVS and Walgreens are two of the pharmacies that get the vaccine, and then they vaccinate those people that they have agreements with. They're called pharmacy partnership plans. And so we are not able to vaccinate any of those people that either work at a healthcare system like that or are participating in one of those pharmacy partnership plans. So we are doing all of the other folks that are not part of those groups. Like Derek has had clinics now. They went to North Home in Big Falls and they did EMS staff that were certified. They had a clinic here yesterday for, there was law enforcement folks over here, I know for sure, that are ones that have to respond to calls, which puts them at risk. And there is another clinic scheduled for the 27th. And a lot of the folks scheduled on the 27th are those folks getting their second vaccine.
Sounds like you got it under control. I'm glad that you guys are doing as well as you are.
Yeah, I think we have it under control. It's very busy and it's a lot of work, but I think it's going pretty well.
I have one. Kathy, I have a question. You hear now that supposedly stockpiles are building up, that the state or someone is not getting them out fast enough. You know, in Minnesota, is there are there enough vaccinations out there that they could be moving them out faster and getting them into people's arms?
We are a bit frustrated with how MDH maybe is making their decisions. They're making decisions that they broadly give to the entire state. And in a small community like this, we feel that we could be moving faster if we were allowed to do that, but we have not been allowed to do that. I don't know that we have a lot of vaccines stockpiled or anything like that, but we do feel that in smaller communities, we could be getting it out there a little bit faster, but we have to follow the constraints that MDH places on us.
So you don't know how many vaccines the MDH has got refrigerated, and it's not, because I'm assuming that it's a flowing river, that there's constantly more vaccines being made. I mean, I guess looking at it as a common guy, if they're sitting there, they might as well be put out.
Yeah, I think there's a lot of pieces that go into that, because when they send out the vaccine, they have to be sure that they have enough for the second dose. And so there's a balancing act between sending out the vaccines, but making sure that the companies can produce additional vaccines fast enough in order to be ready for that second dose for everyone, because it's very important that the second dose to be given within a certain amount of time for both of the Moderna and the Pfizer vaccines. So I know that's where some of the concern comes from. They don't want to be all of a sudden be short on vaccines when the people are ready for their second doses. But no, I do not know how much vaccine is the state has in reserves.
Yes. I may be way off base here, but someone told me that one of the companies, I don't know who, has come out with a vaccine that only requires one dose. Is that true, or do you know anything about that?
I don't know anything about that. Both of the vaccines that we that are available require two different doses, one 21 days later and one 28 days later.
Thanks.
Anybody else have anything for Kathy? Well, thank you, Kathy, for working on that, getting that in the paper. That's, I'm sure a lot of people. Thank you.
Hang in there.
Okay, thank you.
A lot of responsibility there.
This is quite a logistical. Okay, thank you, Kathy. Item number 3 is to approve the minutes from January 5th, 2021 regular meeting.
I'll move, Mr. Chairman.
Thank you,
Second.
Commissioner Pavlik. Thank you, Commissioner Floyd. Any question on the minutes?
Wayne has to behave now because he has adult supervision nearby.
Yeah, but she's got an ambulance appointment this afternoon, so we have to keep moving.
If there's no question on the minutes, I'll call the question. All those in favor?
Aye.
Opposed? Motion carried. Item 4, financial business.
Mr. Chair, I will move to ratify public health 2020 year-end claims, to approve the courthouse claims, and to approve the highway claims.
Thank you, Commissioner Ady, and that is item 4.
B, C, and D.
B, C, and D, okay.
Second?
Thank you, Commissioner Skoye. Any question on the financials? If not, I'll call the question. All those in favor?
Aye.
Opposed? Motion carries. Item 4A. We want to we need a motion on the review.
We need a motion on that.
We need to approve the summarized payment list.
Okay, I'll move on that.
Thank you, Commissioner Edy.
I'll second.
Thank you, Commissioner Murray. Any question on the summarized payment list? If not, I'll call the question. All those in favor?
Aye.
Opposed? Motion carries. Thank you. Number 5, human resource business. Sorry, we missed a couple last time.
Yes, hello, thank you. I do have a couple notice of part-time correction officer hires. We have Michaela Bellinger, Kiana Carlson, and Daniel Sweeney. They all just started last week.
And that's just a notice, so no motion on that, but we do need a motion on the status change of this correction officer.
Yep, I just haven't gotten to that one quite yet. But then otherwise I have our 2021 temp hires listed there as well.
Oh yeah, when temp hires is next.
As we pretty well staffed up for this year. Seems like there's a little kind of turnover there.
Yeah, we still have a couple of slots that we could fill, but I work pretty regularly with Pete with recruitment plans. So we just got these 3. We'll be getting them trained in, determine where our roster's at, and then we'll be discussing what we need to do moving forward as well.
Great, thank you.
Yes.
So we're looking for a motion for the notice of applied status change for correction officer, the E91 dispatch.
I'll make that motion. I'll second, Mr. Chair.
Thank you, Commissioner Murray. Thank you, Commissioner Edy. Any questions on the status change? If not, I'll call the question. All those in favor?
Aye.
Opposed? Motion carries. Thank you, Janelle.
Wonderful. Thank you all.
I still need a motion on the, oh, we just noticed those temp hires. I'm sorry. Okay, so notice of those temp hires.
Okay with that?
Yep, I'm fine with that. And the reason why we do this every year is that we terminate these employees at the end of every year and then rehire them so that their para earnings can restart. So we can only go up to a certain limit. And that's perfect. Okay.
Thank you. Item 6 is authorized annual recording of employee dishonesty and faithful performance.
I'll move, Mr. Chair. We gotta have it.
Thank you, Commissioner Pavlik.
Second.
Thank you, Commissioner Ady. Any discussion on the authorization? If not, I'll call the question. All those in favor?
Aye.
Opposed? The motion carries. Thank you. Land and forestry business. Nathan, how are you?
Good. Hello again.
We haven't seen you for a while.
Yeah. So we are looking to get permission to postpone our scheduled February 3rd timber auction. We just feel that, with the whole COVID situation, we would prefer to push this auction out to potentially sometime early spring, probably April. The last couple of auctions we've been having in Big Falls, we've been lucky enough to get some pretty good weather those days. So we've actually been moving the auctions to outside. And although it's not a guarantee, if we push this auction out till April, we could have a better chance of getting a good weather day to hold that auction outside as well. And if not, the Big Falls Community Building allows for enough space indoors to hold the auction. And then the other thought that we had is, maybe by then there'll be some more folks that are in that higher risk category that will have had the vaccination as well. So it's really, the probability of somebody purchasing a timber tract at this potential or this February auction and actually harvesting it that same year is pretty low. It could happen, but we typically don't see that. So we don't see really any adverse effects of pushing this auction out till the springtime. So what we would do if the board approves this, we would send out letters to all the registered bidders and interested parties to let them know of this, and then I would come back to the board at some point, potentially in March to reschedule it, to set a new date for sometime in April.
I'll move, Mr. Chair.
I'll second.
Thank you, Commissioner Pavlik. Thank you, Commissioner Skoye. That's a good idea, Nathan. The last one worked out great. It was a beautiful day and everybody could be outside.
Yep.
Any other questions for Nathan or for the auction?
If it's raining and storming though, who gets the blame? We'll blame it on Wade.
Yeah.
He's got big shoulders.
If there's no other comments, I'll call the question. All those in favor?
Aye.
Opposed? Motion carries. Thank you, Nathan.
Thank you.
On to our addition item, we'll call it D2. It's authorized the county engineer to award motor grader bid.
That motion. Yeah, I'll make it if unless someone else did.
I think we gotta wait for,
Wait for it.
Let's
Yeah.
see what he's got to say here.
Yeah, there was a little bit of a change here last minute, so we should maybe, Dave, are you on?
David Trent.
It was up there.
He's probably-
Yeah, I guess we're up. I can hardly hear you, but I'll go ahead. Basically, I apologize first about the lateness of this board package. We just got our final revised estimate from Komatsu. They dropped their price almost $15,000, but basically, we have a motor grader in the 2021 budget. If approved for purchase, it would replace the motor grader that was formerly located in Little Fork. Currently, we're one grader short. The Highway Department has solicited quotes for this item after it was approved by the board in December. We have received quotes from Komatsu, Cat, and John Deere. The Highway Department would like to award the base based on the bids that we received and our recommendations. Basically, we would like to purchase the Cat grader, and we cite some reasons. basically our past experience. Currently, we have 6 motor graders. 4 of them are John Deere, 2 of them are Caterpillar. The 2 longest serving motor graders in the county are Caterpillars. They're 1989 units. We have a limited amount of experience with the Komatsu. They did let us demo a unit for about 2 weeks last summer. Our newest grader is a John Deere, and it's a 2016. We had some major issues with this grader while it was still under warranty in September of 2019. The warranty did not cover the cost of the repairs. However, our insurance company bore those costs, the majority of them. It was damaged in a fire in September of 2019. We didn't receive the grader back until February of 2020. And then we had ongoing issues with it until about the July of 2020. And all the ongoing issues were related to the fire on that grader that happened in September. Basically, the county had to spend about $10,000 on costs to rent a backup, to rent another unit. And I think we had a deductible of $1,000. So our past experience, we've had good luck with the cat graders. We haven't really tried a Komatsu, and we didn't have so good luck with the John Deere grader. Also, the service representatives, the nearest service technician for John Deere is in Grand Rapids, Komatsu's in Virginia, and then we just happen to have the Caterpillar service rep in Little Fork. Now, there's no guarantee that the service representative will stay there, but for the immediate future, having a service representative right down the street, we feel is advantageous. So of all the bids, the costs were about $20,000 apart between the high and the low, and $20,000 on a piece of equipment that we probably will have for 20 years. Might not be a good indication of the actual equipment cost over time. But again, we received 3 quotes. We'd like to go with the Cat. It's about $20,000 more than the Komatsu. The Komatsu, this will be the first time they've had a wing plow on one of their graders for snow removal purposes. So, that's another concern too. But, I'll leave it up to the board's decision, but, our recommendation would be to go with the Cat.
Dave, did they give you a date?
Yes, Wade?
Did they give you a firm delivery date?
No, not yet. Most of the time, the real crunch for these graders are for the gravel roads, but I assume the Cat will be rather short because it is a last year's model, so we can purchase that rather quickly and get the snow equipment installed on it. I would assume the Komatsu and the John Deere would be 3 to 4 months out.
Dave, that includes the snow wing and things like that?
Well, all these pieces of equipment, we went with a 60-month warranty, and these are the final costs that we went back and forth with them a couple of times.
I'll move on the Cat purchase, Mr. Chairman.
Thank you, Commissioner Pavlik. Thank you, Commissioner Eady. Any comments or any more questions? Yes, Commissioner Eady.
Dave, this Commissioner Aiden, is this the 6-wheel drive that we were talking about a couple of weeks ago?
No, it's not a six-wheel drive. I mean, the only place we really need the six-wheel drive is up by the lake. Um,
Okay,
and a six-wheel drive would be helpful down by Silverdale, but it's just a four-wheel drive.
okay.
Any other questions? Well, thank you, Dave. If there's nothing else for Dave, I'll call the question. All those in favor?
Aye.
Opposed? Motion carries. Thanks, Dave.
Thank you.
Thank you, Dave. At this time, we're open for public comment. Is there anybody here for public comment?
Mr. Chair, I guess I don't see that approving the committee list on the agenda. We must have missed that when we prepared it.
I'll move on the committee list, Mr. Chairman.
Yep, we can move on the committee chair list. Let's call it B3. Approve the committee list as updated from administration.
Yeah, but we're going to check with Pam, but I can't imagine Pam having an issue, because two of us go there.
Are you okay with that? If nobody has any other comments, I'll call the question. All those in favor of approving the committee list?
Aye.
Opposed? And motion carries.
I'm sorry, who made the first and second on that?
Wade, and I don't know who made the second.
I did.
Kevin did.
Okay.
And then we also need to assign that committee for the business relief grants. Do you want that to be part of that last board motion? Because it is, however you want to do it.
Who's the other one?
Jason? I think if everybody's okay with that, it can be a temporary committee on the list
Okay.
as approved.
Did such a darn good job, and we gotta keep them going here.
Oh, I'm sorry about that mistake on the agenda.
Does anybody have any public comment? If not, I'll look for a motion to adjourn.
So moved, we gotta get Wayne moving here.
Second. Yep.
Thank you. All those in favor of adjourn?
We have to end.
Aye.
Opposed?
Oh, yeah.
Motion carries.